THC, the tetrahydrocannabinol. So the THC is the part that everyone knows about. It's the one that all people smoke recreationally to get high, and it can have that euphoria or a psychoactive effect. But importantly, and I think I want to put this one straight out there, straight off the bat, there's a misconception. Oh, here's some flyers down the front here for my clinic. There's some misconceptions in the community that medicinal cannabis is just CBD. And I'd like to say straight off the bat that that's not correct. Medicinal cannabis does contain CBD, and it's a very important component of the medicine. But I think, in my opinion, the THC component is just as important, if not more important. The THC component of this medicine does many, many things. And it does this by interacting with what's known as our Endocannabinoid System. And this THC actually binds into this system. And we have receptors throughout our body called cannabinoid receptors. And this THC locks into these receptors, and depending on where they are, depends on the effect it has. So it can be great for pain. It works at the level of the spine, slowing down pain impulses to our brain. And not only that, it works on the way we feel our brain, feel the pain in our brain. So what happens when someone pinches you, that's called nociception. So that's when it hurts. That nociception is the feeling of that pain, and it goes into your body. But then the perception of that is what we feel as pain. So what cannabis does, it doesn't stop the nociception happening. People that take cannabis for pain often say to me, look, you know, the pain's not gone, but I can feel it and I don't worry about it. I can get on with my day. So it's very interesting. It changes the way that our mind perceives the pain, as well as slowing down the pain impulses that get to our brain. And THC can work throughout our bodies in many, many ways by binding into this endocannabinoid system. And cannabidiol is the other component of this medicine. Well, there's a lot more components, in fact. There's been over 144 cannabinoids that have been discovered in the cannabis plant. And an interesting aside is that there are also over 400 terpenes and other active plant chemicals in the cannabis plant that have been discovered. And these terpenes and the CBD and the THC, all of those compounds in the plant make up the active ingredients. And I'm sure you would have heard today a lot of mention of whole plant medicine, of full extract medicine. Full extract medicines are ones that have all those active ingredients in the plant. And there is a little bit of anger at Big Pharma in this community about how they're, working with this medicine and maybe doing extracts. And look, some of that is founded, some of it isn't. But the fact is that at my clinic, we only stick to the whole plant medicines rather than extracted medicines. And there's a reason for this. Whole plant medicines are more effective because they have the whole suite of compounds in there. So the CBD, the THC, the CBN, the CBG, all of the terpenes, all of the flavonoids, and they work together better than they do separately. And this has actually been coined in a term called the Entourage Effect. So the Entourage Effect is a term coined by Professor Raphael Mechoulam, who's known as the grandfather of THC. He's the man who discovered the THC molecule, isolated the THC molecule from the cannabis plant back in the 80s, or late 70s, I think it was actually. So he's a very influential professor from Israel, and he coined this term, the Entourage Effect. So that's where the whole is greater than the sum of the parts. The CBD, the THC, and all the terpenes work together. And that's why we need this whole plant medicine to get the best effect out of our medicine. And in fact, they have done some studies, small studies on this, where they tested CBD isolates versus whole plant CBD. And what we found was that the amount of CBD you actually required was about 4 or 5 times for the isolate to have a similar effect to whole plant medicine. That has a big effect on cost, and it has a big effect on effect. So we do need to choose whole plant medicines when we can, and we should support that. And in the natural form, you would have heard about THCA. So when we juice the plant, we get THCA and CBDA. These are the acidic forms of the compounds. And when they've got that little A on the side of them, they can't get into our brain. They're not lipophilic. They don't dissolve in fat. So that means they can't get into our brain. So if we juice even the most potent cannabis flowers and drink that juice, we won't get high from that. We may have good health benefits from that. THCA is thought to be neuroprotective, but we won't get high from that. So we can utilise that from a medicinal point of view. And this activation is called decarboxylation. So that's when we get that THC or the CBD and we heat it up. And what happens, the energy that goes into that molecule breaks off the A, breaks off the acid, and then we have delta 9 THC. So when we smoke a joint, that's what happens. We activate that cannabis. So if we ate the joint, nothing would happen. But if we smoke the joint, we might feel very high from that joint. And that's the act of decarboxylation, or activating our medicine. So that can be the same for CBD or THC. And I know that both of those varieties of medicine are available in this community. So cannabis is a very, very amazing and powerful medicine. But how does it actually work? Well, it interacts with the endocannabinoid system. And you might wonder, why has he got a picture of a little fetus here, a little embryo? That's because from that first point of conception, from when that sperm cell joins the ovum and they start to divide to make a blastocyst, and then they make a little baby, and that baby grows up, the endocannabinoid system is present, it is developing, and not only that, it is leading this baby through its development. It's leading its growth. It's leading where its bones should grow, how they should grow. It's leading where its brain should grow. It's directing everything. And what this endocannabinoid system does, and I must say that everyone in this room has an endocannabinoid system. In fact, every animal on this planet has an endocannabinoid system, barring the insects. So that's every little animal on this planet has an endocannabinoid system, and it has the same purpose in all those animals as it does in us humans. It acts to keep our bodies in balance. The fancy word is homeostasis, but it acts to keep our bodies in balance. So when we get too hot, we want to cool ourselves down like an aircon thermostat. And that's what this endocannabinoid system does, but not just for temperature. It does it for thoughts and emotions, anxiety and depression. It does it for inflammation, arthritis, ulcerative colitis. It does it for bone growth. It does it for glandular secretion. It does it for every single process in our body. So whenever our body feels a stress, so whether we get burnt or we fall over and hurt ourselves, or we accidentally eat some poison that's in our food and cause some inflammation, that's a stress on our body. And this endocannabinoid system is turned on, and it's the idea of it, when it turns on, it secretes our own cannabis inside our bodies, and they're called endocannabinoids. So we secrete our own cannabis inside our own bodies on demand to stress. And the receptors for this endocannabinoid system, they don't just stay where they are and that's it. They come in and out of our cells. They're expressed throughout our body, and they're expressed in areas of need. So for instance, in someone with arthritis in their knees, they'll have lots of cannabinoid receptors being expressed on the tissues around the knees, and in the white blood cells around the knees, and in the lymph nodes around the knees. And these are like little flags waving to our body saying, hey, we need some attention over here. We need some attention over here. And so what our body does then, if it's able to, and it usually is secrete these cannabinoids into our blood system right where they're needed. And these cannabinoids are called anandamide and 2-AG. Now they're the most common ones. There's a lot more endocannabinoids. And this is a picture here showing radio-labelled cannabinoid receptors. So you can see there's a lot in the brain. There's a lot in our reproductive organs. There's a lot associated with all the nerves and blood vessels of our body. Cannabis One receptors, there's two main types. Cannabis One receptors and Cannabis 2. There's various other minor cannabinoid receptors, but they're the two main ones we need to think about. Cannabis One receptors are found in our brain and in our central nervous system, associated with all the structures of our brain and our nerves. They're found in a place called the periaqueductal grey in our spine, and they regulate that chronic pain impulse reduction. They suppress that chronic pain impulse. That's why people smoke cannabis, for their pain. Cannabis One Receptors are also found throughout the brain in all the important areas. They're found in the cerebral cortex, the main bit we do our thinking with. They're found in the amygdala and the hippocampus, the deep parts of our brain that are associated with memory and emotion. And they're in the cerebellum, so they're associated with movement, and that's why we sometimes get a little bit wobbly if you take too much cannabis. Importantly, where they aren't is an important thing, and the one place they aren't is in this little section of our brainstem that controls our breathing and our heart rate, our breathing and our respiration. And because they aren't there, it means that no matter how much cannabis you take, you can't stop yourself breathing with it. It's impossible. There is an estimated lethal dose for cannabis, THC in particular, and that estimated lethal dose is about 10 to 15,000 times the standard dose. I'm not sure of the exact figure, but it's in the region of 50 kilos or something of cannabis that you need to eat within an hour. So it'll probably be a little bit hard to get down. So this endocannabinoid system is very, very important, and it's how our cannabis medicine works in our body. So these molecules interact with the cannabis system, and depending on THC, depending on where they're showing up, is where they affect. So that's why cannabis is an amazing multimodal medicine, a multi-system medicine. We might be trying to fix the pain in your knee, but we might accidentally fix the pain in your head, that emotional pain they call anxiety or depression. Or we might be trying to fix the pain in your belly, but we accidentally fix up your ulcerative colitis. So in the legal system, this is the endocannabinoid system, and it's just indicating all the areas of our body that are so important in this system. The brain we've covered, the lungs, bronchodilation. So I've actually got patients with emphysema and chronic COPD, breathing issues, that use vaporised cannabis to help bronchodilate their lungs. So this lady who used to be only able to walk maybe 70 metres is now getting to a yoga class, getting to a Pilates class with 1 or 2 small vaporisers of cannabis daily, a THC-containing variety of cannabis, yes. Because it's the THC which is locking into these cannabinoid receptors in the lungs that make them relax and make them dilate. What we also find as a side effect of cannabis medicines is sometimes we have a drop in blood pressure. This can be great. Some of my patients have gotten off their blood pressure medications. And once again, this is because of the relaxing effect or the vasodilating effect of cannabis on our blood vessels. It relaxes our muscles. It relaxes the smooth muscles of our body. It slows down the excessive impulses in our brain associated with epilepsy or anxiety. They're found everywhere in our body. And this amazing endocannabinoid system keeps us healthy. But over time, what we find is sometimes this endocannabinoid system gets tired. Over time, from poor diet, from environmental pollution, from herbicides and pesticides that are commonly in our food, through pharmaceutical medications being used too much and too frequently, through antibiotics harming our gut biota, we get a decrease in endocannabinoid tone. So when you're young, when you're 15 years old, nothing's wrong with you. You can run around, you can eat whatever you like, you can stay up late, you can do anything, and you seem to get through it all right. But I know probably a lot of people in this room, I've just turned 40 not too long ago, and I did notice that when I turned 40, things started to change. There was a little bit more pain. There was a little bit more tiredness. And so this endocannabinoid system, we have to look after it. And we have to make sure it's healthy enough to produce endocannabinoids, because as this tone decreases over life, we end up with what's called endocannabinoid deficiency. And it's not the end of the world. But what happens is everyone's endocannabinoid health or tone slowly decreases over time unless we actively support it. And we can actively support that through cannabis medicines. We can actively support that through good diet and avoiding environmental toxins and taking in the correct nutrients into our body. But when this endocannabinoid system can't keep up, it can't keep up the maintenance of our body, then we start to get symptoms of disease. We might start to get sore knees. We might start to get pain. We might start to get more inflammation than our body can handle and end up with arthritis or fibromyalgia or ulcerative colitis, inflammatory diseases. And this is the man here that termed that syndrome or that deficiency, Endocannabinoid Deficiency syndrome. And his name's Dr. Ethan Russo. And I've had the pleasure of meeting this man and talking with him about exactly this, the importance of supporting this endocannabinoid system. And what he found through years and years of work, he's a famous doctor from the States. He was involved in making a product called Sativex, which is one of the first, is the first cannabis medicine to be on the ARTG, so it's registered with the government. He noticed that there was a group of people that seemed to be suffering from what he thought was a lack of ability to produce their own endocannabinoids. And they had a group of diseases, and they encompassed things like migraines, fibromyalgia, endometriosis, anxiety, many, many inflammatory diseases, ulcerative colitis. So what happens is, over time, your body can't keep up to the maintenance and can't keep up to that regular support of our healthy living, and we get symptoms of disease. And this is where cannabis medicines come in. So we can support this endocannabinoid system by taking CBD and THC containing medications. And even the smallest amounts of THC will stimulate the endocannabinoid system. Even 1 or 2 milligrams. Levels of cannabinoids below perception. So you're not going to be high, you just have almost a little whiff, a little smell or a little taste. And that micro dosing of THC is known to upregulate the endocannabinoid system. So if you took a little bit every day, even if you never ever felt high, what you're doing is increasing that endocannabinoid system's tone and stimulating it and making it a little bit more healthy and making it a little bit better at holding on to any endocannabinoids or any THC we put into our body. And CBD, that's all it does. CBD doesn't bind directly into the cannabis receptors of our body. CBD supports our endocannabinoid system. It binds on the side of our cannabis receptors and makes them stronger at holding on to endocannabinoids and THC. CBD slows down the breakdown. It slows down the action of a molecule called FAAH. And that FAAH is one of the enzymes that breaks down our endocannabinoids in our body. So it stops the breakdown of endocannabinoids in our body, or slows it down, so they stay active for longer in our body. The CBD really doesn't interact directly with the system, but supports the whole system to work better. THC binds directly into it, so I think we need both components of those medicines. And CBD is something which I think is an amazing molecule. I use it a lot in every day. In fact, I use it every day. And I rarely use CBD and THC alone. So when we're talking about looking at patients with anxiety, CBD is a great idea. Patients with inflammation, CBD really works to reduce inflammation in our body. CBD is a great idea. But THC is the molecule that directly interacts with our system, so I feel it's the more potent molecule in a cannabis medicine. And CBD helps reduce the high effect of THC in our bodies. So that means if we use CBD and THC together, we can have more THC before we get uncomfortable, and we can get more therapeutic effect. We can get better medicine. Using THC alone, small amounts of THC are good for anxiety, but large amounts of THC can make you very anxious. So I never prescribe THC alone. I always use it in conjunction with CBD. And I did hear some conversations before about what's the difference between CBDA and CBD, or decarboxylated CBD. One's raw, one hasn't been heated, and one has been heated. And the same with THC and THCA. Talking about strains of cannabis, there's 1 million different chemovars, not 1 million maybe, but definitely tens of thousands of different chemovasal strains of cannabis. What is medicinal cannabis? Medicinal cannabis can be any cannabis, but I think the important thing about medicinal cannabis is a few things. One, we're taking it for a reason besides recreation. So we're taking it for a direct reason, whether that be anxiety, whether that be pain relief, whether that be curing cancer, whether that be making our appetite better when we're having chemotherapy. The second thing is regularity. You might smoke cannabis once every couple of weeks as a recreation, but in my books, when you're taking cannabis as a medicine, it needs to be regular. And this is so we can access those effects that I've been talking about on the endocannabinoid system. When you take THC, it has a direct effect, and you can feel it almost instantly if you inhale that product. It takes about an hour and a half if you eat that product. And that's a noticeable effect. So you can vaporize some cannabis and have immediate relief from that pain in your knee. So we know that's directly connected. The thing with CBD is it's kind of like an antidepressant in a way, or it's CBD, because it doesn't directly get you high, it doesn't directly affect you. You might not notice it happening, but I think you need to give it at least 2 weeks regularly using that CBD to increase that health of your endocannabinoid system before you're going to see results. Because that's the end point, is when you take CBD, you're not directly stimulating the system, you are supporting your own body to make more of its own cannabinoids and utilize them better and then get a result. So it's like when you take an antidepressant, an SSRI that keeps the serotonin levels high in your brain, it takes a couple of weeks or a month before those levels get up enough before you notice it. So there's a very, very distinct difference between those two molecules there. And when we talk about strain of plant, it's very important. I practice only whole plant medicine in my practice, meaning I use medicines extracted from the plant which contain all the cannabinoids that are in there, all the terpenes that are in there, all the flavonoids that are in there. And you would have heard people talking about ratios. Oh, we need a 1:1. No, we need a 20:1. No, we need a 2:3. What are they talking about? They're talking about how much THC is in that medication and how much CBD is in that medication. We only consider those two main cannabinoids generally, though we should consider them all in our minds, but from a doctor and a prescribing perspective, we mainly look at those two. So a 1:1 medication means 1 part THC, 1 part CBD. So equal amounts of those molecules in the flower or the oil or whatever you're using as medicine. A 1:20 medication means 1 part THC is to 20 parts CBD. So this is something which I use commonly in children, and it's very useful for epilepsy, and it's very useful for autism, and it's very useful for anxiety. And these ratios come from the actual plant that is grown. You can combine two plants, but basically the principle of it is, if you want a 1:1 ratio medicine that is the most effective and a whole plant medicine, you grow a plant that has those chemicals in that mix already in the plant. And there's tens of thousands of different plants out there, all with different mixes. Some might have that one little bit of THC and 20% CBD, excellent for epileptic children. Some would have very high THC and almost no CBD. This is probably a result of the recreational market and the prohibition over the last 80 years. Because THC, not the whole plant has been made illegal or demonised, but THC in particular has copped the brunt of that legislation because it gets people high. So what happened is it got made illegal back in the 40s or late 30s, and all the growers of this cannabis medicine, well, it was all for recreation. And when people want to recreate, they want to get as high as possible. They only want the THC, really. They don't really want the CBD. So the growers focused on growing plants which would get people high, which have a very strong psychoactive effect. Prior to this, plants may have had a high level of THC, but they may have also had a high level of CBD, and no one really worried about it, but the CBD was there. And these medicines were made with high amounts of CBD. The tinctures that our great-grandparents would have been able to buy in the chemist in Australia back in the 30s. It was a readily available medicine through the chemist. Would have been extracted from plants which had high CBD in them and high THC in them. So there's been a resurgence in the last couple of decades with the movement towards medical legalisation around the world and recreational legalisation around the world to bring back the CBD, bring back this CBD element in our medicines. So now we are lucky enough in this world to have the option to choose plants that give us the ratios we require. So this really points out that cannabis medicine is unique and specific, not only specific in how it reacts with your body's endocannabinoid system, but specific in the ability for us to choose naturally grown medicines the way nature intended them, extract those medicines, as we saw outside there with an ethanol extraction at lunchtime, and have our medicine ready-made and available in the ratios which we choose or which your cannabis doctor can help you choose, or many of the experienced people in this community can help you choose. So there's many, many ways that this medicine works for people. So I've got a lot of slides here and we'll just keep scrolling through them. But I want to explain to you how the legal cannabis system works in Australia. It's something that I work in every day. I've been consulting in cannabis medicine since the end of 2016. As I said, I've done over 1,000 patients so far. I started up a cannabis clinic called Plantmed, Medicinal Cannabis, in Brisbane, Australia. And we're lucky enough to have expanded to have another 5 doctors on our team since the beginning of this year. And that's purely because of the demand, purely because of rooms like this filling up with people who want to know about how their body works and how they can help their body heal. The public push is so important in this movement. So, cannabis medicinally is legalised in Australia. You are eligible for medicinal cannabis if you have a symptom which has not been relieved by conventional medications or conventional therapies. That's the rule. So there's a misconception that you can only get medicinal cannabis if you're a child with epilepsy, if you have multiple sclerosis, if you have cancer and have cancer pain, or you have nausea and vomiting associated with the chemotherapy of cancer. Those are 4 very commonly approved areas. But to give you an example, or several examples, I've got patients that have been approved for anxiety, PTSD, obsessive compulsive disorder, ulcerative colitis, fibromyalgia, various types of cancer, chronic obstructive airways disease. The list goes on and on and on. Basically, any ailment that you may have that has not been fixed by a pharmaceutical medication or a standard therapy, then you are eligible to access medicinal cannabis in Australia. So if you have pain and you've tried Panadeine Forte and Tramadol and it didn't work for you, or it made you feel constipated or nauseous or fuzzy in the head, you're eligible for medicinal cannabis. If you have autism spectrum disorder or ADHD and you've tried some sort of sedative or some sort of Ritalin for that ADHD or some sort of diazepam, we're very happy to give kids diazepam and risperidone, but we're not quite so comfortable giving them cannabis, and I think it's such a funny area we live in these days. But anyway, basically any ailment in Australia can be prescribed medicinal cannabis, so long as your doctor is willing to prescribe it and has some proof to back himself up. That's the hard part, maybe. So, any doctor in Australia can access medicinal cannabis by what's known as the SASB pathway. That's the TGA pathway. Basically, if you come into the clinic, I'll have a chat with you. We'll find out that you fit the requirements, and then fill out the forms on the internet that goes directly to the government. A week, or maybe sometimes even 4 hours later now, but within the week, usually we've got that approval back, and we can prescribe that medication to you, and you pick it up from any pharmacy like a normal medication. I write a script like a normal script, you take that script to the pharmacy and you pick up your medication. It's that simple. At our clinic, because of the way we work and because we have a lot of patients that aren't our regular patients from day dot, we do require a referral from another doctor. That can be your GP or your specialist. But if you have a regular GP and you see him all the time, he can prescribe this medicine for you. If he doesn't, he can simply do a standard referral letter and send you along to a clinic like ours at Plantmed, and we can take care of that process for you. We look at your health, we look at your endocannabinoid system and how we can support that. We make a decision on what ratio medicines are going to be the best for you, whether you need a lot of CBD or a lot of THC or a combination of both. Whether you require oils or whether you require a vaporized flower product to inhale. I make all these decisions for you, and we work together just like any standard doctor-patient relationship until we get your health healthy. And then what we find is then after about 2 or 3 months, we usually get to a place where we found a balance in your medication, and we just continue along, touching base as necessary, writing a script for you when we need to refill your medication. But after a while, we find a happy place for you, and that's your medicine, your personalised medicine. And I encourage my patients to help modulate this medicine. I get them to keep a little diary of how much they're taking and how they're feeling and give their pain score a score out of 10. And then when I have a look at that diary and talk to them, and they might say, oh, it's working great, I'm sleeping really well at night, but I feel a bit hungover in the morning, and then my pain comes back at 2 in the afternoon. And I'll say, well, that's because you're only taking your THC at night. How about we add a morning dose of that THC, and if we're still getting the pain at about 2, we might need to add another one at 12. So it might be 2 small doses in the morning and then 1 at night. And we'll have a baseline of CBD underneath that. So we've come up to some case studies that are scrolling by and behind us. And this is an interesting story. MB, a 51-year-old man, and he came to me earlier this year. He had a lot of anxiety, he had a lot of anger issues. He suffered some abuse at the hands of a female perpetrator when he was a young child, and had a lot of anger issues with women. Unfortunately, he was the head of an aged care company and had to deal with a lot of women all the time. So he found himself exploding at these women, losing it in rage, very anxious, social anxiety. He'd have trouble with panic attacks. He'd have to take himself home, and if he'd have a meeting with someone at work, he'd have 2 Valiums beforehand to try and settle himself down so they could get through those meetings. At the time, he was on a standard SSRI, Zoloft, an antidepressant, and he'd use diazepam or Valium every day to help him sleep, even though he didn't sleep very well. He'd get about 5 to 6 hours sleep a night. And he tried a whole bunch of other antidepressants and anti-anxiety medications that really weren't working for him. Next slide there, Sista. So this man was vaporising cannabis every evening already when he came and saw me. He'd been smoking since he was a young man, and he felt it helped him with his anxiety, but it was still there. So we had a chat, and I did all my normal things, and we came up with a slightly different plan that I'd normally come up with for someone with anxiety. For a straightforward anxiety case, I'd probably just start with a decarboxylated CBD medication, 1:20 about ratio, and up titrate there and see how we go. And maybe consider adding in a small amount of THC as an oil form. Not enough to worsen anxiety, but just enough to calm and take away the edge of that anxiety. But in this case, because he was an experienced smoker, or cannabis vaporizer, and we had to take that into consideration. So what we did was we had a Cbd oil dose, 1 little bottle of CBD, and I prescribed him 15 milligrams twice a day under the tongue, buccal, sublingual. And everyone would have told you, yep, you just got to put your drops under your tongue, but they may not tell you why you need to do that. So when you put your drops under your tongue, some of those drops absorb straight through the skin of your mouth, the inside of your mouth. And because of the way our bodies work and the way the blood flows through our body, that means that whatever gets absorbed through the mouth gets pumped to the heart and then around the body before it gets back to the liver. And the liver's where it starts to get broken down and metabolized. So we get a extra free couple of pumps around the body of these molecules before they start to get broken down again. So we get a little bit better value. That's the reason we do it under the tongue. The rest you swallow and it goes to your stomach. But anything that goes to your stomach or your intestine goes past a thing called portal circulation. And that means the blood from that part of your bowel and stomach goes straight to the liver. It's like an expressway straight to the liver. And this is for many reasons, because that's where our food's metabolised, that's where all of the drugs are broken down, that's where cannabis is broken down as well. So that oral medication goes straight into the stomach and then to the liver and gets broken down sooner. So you don't get quite as much value out of that medicine. That's why we do the sublingual thing. That's just a little aside. We also gave him a THC oil to use at night. And you heard Michael talk about start low, go slow. So that's something I do believe in as well, especially if you've never taken cannabis before. It's important to go very slowly initially to get your body get used to the effects. So we might start at 2 milligrams in a go, 0.2 of a milliliter, 1 drop, nothing. And we might go all the way up to 3 millilitres a day or 60 milligrams a day of THC as an oil. You know, the range is very, very wide and it depends on every person's individual response. So we decided on a THC indica oil for him in the night time to help with his anxiety and to help with his sleeping. And we used an 18% THC indica flower. Because he was vaporising already, we said, well, let's continue that. That's working for you. But let's think about this saying this to myself in my mind, let's think about this in a scientific way, a doctor way. So this man likes to vaporise, so he gets a high THC level, then it drops away after 2 hours, and that makes him feel good, but it hasn't got rid of his anxiety. It doesn't help him sleep. So what we need to do is we need to support the endocannabinoid system, reduce his anxiety, because CBD is a known anxiolytic, so we'll have a baseline CBD oil dose. And we'll give that 2 to 3 times a day, because that means it'll stretch out through the whole day. That's good. But I think we need more THC in this man. He seems to like it, it works for him. Normally I wouldn't use THC on someone who's anxious, or I'd only use very low dose, but he likes it. It works for him already, so we'll add in THC for him. And what we'll do is increase his baseline blood level. So we'll give it to him once or twice a day, see how he's going in his lifestyle, how he works, and that'll increase his base blood levels, and then he'll probably vaporise on top of that anyway, but he probably won't need to vaporise quite as much as he used to. That's what I thought to myself. And then I saw him again a couple of months later, and he was using the 15 milligrams of CBD twice a day, and he was using 16 milligrams of THC oil at night, so that's of the medication he had, that was 0.8 millilitres per night. And he was also having 1 or 2 vaporisers in the evening after work. He'd removed the diazepam and he'd halved his sertraline on his own volition, even though I said, please don't do that to him. He decided that he felt better, and so he did start to reduce those. Luckily, in this case, there was no side effect. Sometimes if you take away those medications quickly, you can have a rebound effect on your mental state. He hadn't used that any diazepam, and his sleep he was getting 8 hours sleep, which was great for him. His anxiety was greatly reduced, and he was calmer at work, and he didn't yell at his staff. Very good. Yeah, so he was pretty happy with that. And then I saw him again at the end of that month, and we'd still kept the CBD the same. He'd slightly increased his THC to 20%. This man noted complete relief from his anxiety, sleeping great, hadn't yelled at his staff or had to take any Valium to deal with work, feeling much better, and he actually wanted to reduce his SSRIs, so I thought I'll write his other doctors a letter and say, let's start reducing this together. It's important that we do reduce medications carefully under medical guidance where possible. So a great result there. So we could scroll through a bit more, I think, Sista, and there's a few more. Just keep going down a bit there, keep scrolling through for a bit. I might take some questions actually, because I think this is usually a very educated audience at Medicant. And one second, and we'll take a few questions. And if there's anything particular, I might have a case study or two up there that we can refer back to. But up the back, Dr. Catalara's first.
Is everyone hearing that? We're not hearing that.
Yeah, so that's a very good question, and I definitely ask all the suppliers. The question was, why don't we have full terpene and cannabinoid profiles in our medications? That's because at the moment there's not enough demand for it. So I always ask the suppliers, I say, can I have a terpene profile of your medication, please? Oh, we haven't got one. Well, could you get one? Because I'd like to know. And, you know, we do only consider the THC and the CBD generally, and it's a general guide, that's sufficient. But essentially in the legal market, all the companies have got their own strains or chemovars, which are the types of plants. So red tomatoes, yellow tomatoes, green tomatoes, they're all chemo variations, chemical variations of the same plant. And we have tens of thousands of those of the cannabis plant. So when we take a whole plant extract, we get all of these components of the medicine in that oil or that medicine. And included in that is terpenes and flavonoids. And I think it's a very fair comment that we should have access to those profiles. And to be fair, I was given a sheaf of papers the other day in electronic format for a company because I asked them for their terpene profiles, and they actually said, oh, well, we actually have got some of those, I'll send them through to you. So they're not being made readily available on websites of the companies, and I think that's purely because no one's asking for them and they haven't had to test for them. Yeah. Yeah. That's true as well. You know, we're at a very early stage. The question was, why is there no non-decarboxylated THCA products available through the legal market at the moment? And the answer to that is, I don't know. Yeah, they should be made available. They should be made available, and they will become available, but it's kind of like a supply and demand thing. I think there'll be many, many formats of medicines that will come forward. At the moment, the majority of medicinal cannabis medications are in the oil format. There are some capsules coming out at the moment, which are sort of pre-dosed, capsulized volumes of CBD and or THC. You can definitely get different varieties of flower as well that I can prescribe. But at the moment, no one's come through with a non-decarboxylated THCA. And I think that's just a matter of time as well. You just look into any market overseas that's become regulated and you'll see there's a myriad of products available. And so I think that's just a matter of time before they're all available here in Australia too, through the legal pathways. Yes.
As we talk to Dr. T, I do give preference to those who walk up to the microphone, please. It's so much better.
It is.
All right, so please talk on the phone. Just
Hi.
come on.
Thanks. My dad's got Parkinson's, and I was just wondering, like, what would you use it for? And is it just like it reduces the symptoms or relaxation?
Yeah, excellent question. So it was about Parkinson's and how I would treat Parkinson's. Parkinson's is really interesting because Parkinson's is a decreased production of dopamine predominantly in our brains in an area called the basal ganglia and the substantia nigra. So they're like the deep parts of our brain, the bits that produce dopamine. And dopamine regulates many, many things in our bodies, but in particular with concern with Parkinson's, what happens is we don't have enough dopamine production, and then we end up with tremor and spasticity and pain, and over time it gets progressively worse and worse. So what I would do to treat Parkinson's from a cannabis medicine point of view would be to support the endocannabinoid system. I go through that specifically with each patient. But in general rules, it's nutritional and some vitamin supplementation, making sure we've got the precursor elements to your endocannabinoids. So that means omega-3 oils are very important for brain function. So they're the good fats. And those omega-3 oils are the ones that turn into our body's cannabis, our endocannabinoids. So we make sure that that system is as healthy as possible. And interestingly, when they look at the brains of Parkinson's patients and they radio label things and see where all the cannabis receptors are, we see that there's an overexpression of cannabinoid receptors in, surprisingly, the basal ganglia and the substantia nigra, the two areas of the brain which are deficient in Parkinson's. So that means that in my mind that these are the two areas of the brain that are like, hey, over here. Over here, come and fix me up. I need to make some more dopamine so that I can move better and survive and not get eaten by the lion that's chasing me, so let's fix this up. But in Parkinson's, we haven't got the ability, our endocannabinoid system hasn't quite got that ability to keep up with its own production anymore. So what I would do is I would supplement that man, your father, with, in Parkinson's, generally a 1:1 medication works very well. So an equal balanced CBD THC oil, and I would start that dosing quite low. I would start at 2 to 5 milligrams 3 times a day. I would start just at night time if he's never had cannabis before for a week, and then I might introduce a very small morning dose and a very small lunchtime dose and a larger evening dose. And then each week I would increase that dose by about 2 to 3 milligrams, depending on how your dad's tolerating that. And I would talk to him and have a chat on the phone and say, how you feeling? Have you felt high yet? Can you pick up your teacup yet? And because he's probably got really bad shaky hands, I would probably think I'd give him a soft gel capsule so he can actually use it and not have to draw up a oil out of a dropper or a syringe. And Parkinson's is something that responds very well to cannabis medicine support. It's not always quite as good as you see it on TV, and I'm sure you've seen the video of the man who takes some oil and his Parkinson's calms down in 10 minutes. Saying that, I have got a lady with Parkinson's disease who I do vaporizer lessons for people that haven't vaporized before for my patients. And we got this lady who'd never smoked she'd had oils because I prescribed them to her, but they weren't working really well for her. So we thought we'll try a vaporized flower product. And she had a neurodegenerative disease, kind of like Parkinson's. And she hadn't moved her arm in 2 years. And so I taught her to do this vaporizer, and then she just wriggled the fingers in her arm and moved it about that far. But for her, that was amazing. She just couldn't believe it. Her husband started crying, so amazing results. So that's how I treat Parkinson's.
Thank you.
No problem. Yes.
Hi. In the United in Compassion Forum last year, one of the speakers said that if you're taking medicinal cannabis, at some point, just stop for a couple of days and then sort of reboot. And I've never really had any further knowledge on that. All
right, so what that person was referring to would be what I call a Cannabis Holiday. So if you've been taking cannabinoid medicines, THC in particular, chronically, meaning all the time, regularly, especially at a high dose, so if you're trying to treat, say, your cancer, and you're taking a high dose medication, what happens is your body gets used to that high level of cannabis pumping around it. And so it doesn't need to have as many receptors out to catch the cannabis to get its action. It only needs to stick one out and there's going to be some cannabis going past, so it'll use it.
That's a bit lazy.
It gets called tolerance. So it's the same as opioid tolerance. If you take increasing amounts of opioids, eventually you'll need a bit more and a bit more. And that is true of cannabis as well. We gain tolerance, and we can use that to our advantage because if we don't gain tolerance, we can't get a high enough blood level to have an effect that we may want, say pain relief or anti-cancer effect. So by taking 48 hours, as a rule of thumb, completely off cannabinoids, what happens is that drop in cannabinoid levels in your blood will signal to your body that, hey, we need to make our own cannabinoid, and we need to make our own endocannabinoids, and we need to work better, and the cannabis isn't flying past us. So those receptors will exvolute or pop out of the cell again and express themselves again.
Right.
So what you'll find there is that you'll be able to go back onto your cannabis
At the dose that you left off?
at a slightly lower dose. Yeah, so if you find that you're taking cannabis for pain and you've been taking, say, 1 milliliter twice a day for 6 months, but then you're finding, well, I'm starting to need 1.2 millilitres or I need 1.5 millilitres, and you're using more cannabis than you expect, every 3 to 6 months, it might be a good idea to take 2 days off
Yeah.
and deal with that pain or that symptom for 2 days and allow your body to recalibrate and then start again at just a slightly lower level, and you'll save some money and get the same effect.
I do have one more question. Oh, sorry. One quick question.
Yeah, sure.
So if somebody has been given the all clear for cancer, just using that as a specific example, and they've been taking medicinal cannabis, how long do you think that they should continue on? Like, you know how that you've given us sort of the 5-year all clear?
Yeah.
So do you...
So once you've beaten, and look, cannabis doesn't always fix cancer, and often it depends on many, many factors. When you start, because you want to start as sooner the better, how progressed your disease is, what other things you're doing in your treatment of your life.
Yeah.
But as a rule of thumb, if you're using high-dose cannabinoid therapy, and this is the experience from my colleagues overseas as well, and if you want to check out more information on this, go to www.australiancannabissummit.com, and we've got a lot of videos, and I talked to an expert in this field about this particular thing. So after you've achieved remission and the cancer is gone, you got the all clear, you reduce down that high dose. You may have been taking up to 500 to 1,000 milligrams THC and CBD combined per day to treat this cancer. And once you're on the all clear, whatever that dose is, you reduce it down to about 10 to 20%.
Oh.
So once you're in that all clear area, you reduce down the cannabinoid level because you won't be able to afford it anyway, and because you don't need to do it. And often your body will tell you as well, you'll be taking that dose which you used to be able to tolerate very well, and all of a sudden it'll be too strong for you. So you listen to your body, but then you take that down to a maintenance dose of about 10 to 20%, and continue that.
For ever.
Continue that.
Ever.
Yeah, because if you take your body, and this is an emerging area, and there's no hard, fast rules, but if you just stop your cannabinoid treatment, that's going to be the situation in which you got your disease. So unless you change your diet and everything in your life, you've changed all these things in your life, you get cancer, and that's what happens. You change all these things because you got to, and you do, and you commit to it, and you change them all. You've changed the environment of your body, you've changed the chemical makeup of your body, and your body is using this cannabis medicine and cannabis food to support itself. Why would you deprive it of that? Give it those molecules that it needs to support that endocannabinoid system and your immune function and your inflammation, and maintain it at a lower dose.